morning everyone. I am presenting just a case. It is a clinical conundrum unveiling a rare case of malignant hydroadenoma masquerading as meibomian gland carcinoma. Uh, Nodular hydroadenomas is a cutaneous neoplasm that can occur in various locations. It has been referred to a clear cell hydroadenoma or eccrine sweat gland adenomas. Eccrine sweat glands gives rise to intradermal nodules called hydroadenomas. Nodular hydroadenomas are transition between eccrine poroma and eccrine spiral adenoma according to ultrastructure and enzyme histochemical investigations. Typically, they are seen mainly in middle-aged peoples, more common in females. Clinically, it usually manifests as a single solid cystic intradermal nodule. Here, I will be discussing a case of a 77-year-old male who is presented to us with a right eye upper lid lesion. A case report of 77-year-old male who presented with painless multinodular swelling of right upper lid since 7 years, which was gradually increasing in the size. There was no history of diminution of vision or history of trauma. Here is the on examination of the eyelid tumor. It was multinodular swelling of the right upper lid, size approximately 16 into 17, ill-defined margins, firm in consistency, immobile, non-tender, fixed to underlying eyelid structure with feeder vessels and leading to mechanical ptosis. Here is the clinical photograph of the patient. The examination of both eyes were normal and patient was pseudophakic in both eyes. Fundus was normal. Coming to the management part, patient was planned for wide excision biopsy with 4 mm clear margin excision and sent for histopathology. Further, patient was planned for Cutler-Beard 2-stage reconstruction surgery. Early detection and management with multidisciplinary approach may save the patient from debilitating carcinomas. Here is the histopathology report. As we can see in the image 1, the A pointed is towards the fibrous septa, making the multilobulated architecture. B is showing the clear cytoplasm and C is showing the high mitotic activity. Coming to the image B on the left side, the A is pointing towards the cystic space. The white color thing is cystic space, and you can see the B is pointing towards the infiltrative tumor and C is pleomorphism. Coming to the discussion part, tumors arising from the sweat glands of the eyelid are usually uncommon, and the difference in their structure have given rise to much confusion. A wide variety of descriptive terms have been applied to sweat gland tumors. Histologically, sweat glands can either be eccrine, apocrine in nature. Eccrine glands are present throughout the skin but most abundant in palm, soles and axilla. In the eyelid, eccrine glands are present in the lid margin and in the surface of the dermis. Eccrine hydroadenomas are also referred to as nodular hydroadenomas or clear cell hydroadenomas arising from the eccrine sweat glands. This nomenclature is based on the electron microscopy and histochemical studies. Clinically, usually they present as a solitary intradermal nodule, but which is well circumscribed and may appear encapsulated. Similarly, here the case is multinodular presentation. However, hydroadenomas do not present with discrete clinical characteristics that allow differentiation from the other eyelid tumors on the basis of clinical. We can differentiate them on the basis of clinical and microscopic findings. The differential diagnosis includes primary skin tumors like follicular, sebaceous, sweat gland differentiation. Hydroadenomas can mimic as cutaneous metastatic disease from the clear cell tumors such as renal cell carcinoma. The possibility of the primary basal cell carcinoma with eccentric differentiation and the lobular hyalinized syringioma should also be included. Coming to the conclusion, why I am presenting this case. Because of the variation in their structures, tumors originating from the sweat glands of the eyelids are rare and have a great deal of misunderstanding. The sweat gland tumors have been referred to a wide range of words. Malignant hydromas of the eyelid are very rare adnexial tumors, exceedingly low incidence of 0.001%. For early diagnosis, sweat gland tumors should be taken into account while making a differential diagnosis for eyelid tumors. Malignant hydradenomas are distinctly unusual and extremely rare in the eyelid. The possibility of sweat gland tumor should be considered in the differential diagnosis of eyelid tumors to ensure the early detection. And finally, the management involves complete excision of the lesion followed by lid reconstruction. Here are my references.
Okay, fine. Please go back to your one slide. You are showing the clinical picture. Clinical picture of. Okay. In such cases, you are mentioning cutler beard managed by, and two points you mentioned. I am little confused regarding clear margin of 4 mm or 4 or 5 mm and managed by cutler beard. Is it? I think it's a huge one. Is it possible?
Sir, on after the excision, they did uh, cutler beard reconstructive surgery, but after primary excision was done there and primary closure was done, and after the report only they.
Okay, you can that point.
Yes, sir. It was yes, sir.
Yes.
Yes, ma'am. Yes, ma'am.
So ideal is this in such cases you can go for a for posterior lamella by mucous membrane of that other, and then you can use a labeller one to reconstruct both the leads. Okay, thank you.